IVP Media presents Fairhope Hospice Today, brought to you by Fairhope Hospice and Palliative Care, Fairfield Federal Savings and Loan, the Fairfield County Board of Developmental Disabilities, and the Frankie Smith Funeral Home.
Hi, and welcome to Fairhope Hospice Today. I'm Kristen Glazier, President and CEO here at Fairhope Hospice and Palliative Care, and I am joined, home of the Pickering House, and I am joined here by two of my colleagues, two of our physicians that are here with us at Fairhope and have been with us for a very long time. And we, instead of shooting today from the family room, we're here in our Gorsuch room, our meeting room. And I'm going to allow our physicians to introduce them, and we're going to get started. We have lots of good things to talk about today. Dr. Varney, welcome.
Well, thank you. Good morning. I'm Dr. Brian Varney. I am a family physician by training, but basically a geriatrics and hospice physician by trade. My practice very early on niched itself into elder care. When I graduated residency from Grant Medical Center in 2003, I wandered into Lancaster kind of figuring out how I was going to start developing my practice here. And I stumbled across Fairhope Hospice when it was located down in the Kroger parking lot. And I just walked in and introduced myself and met Denise Bauer, the previous CEO. And it just so happened, by God's grace, that there was a position open there. It was a volunteer position, but it gave me the opportunity to get involved with Fairhope Hospice. So I volunteered there for a couple of years, and somewhere around 2005, I think it was when a actual position opened up, and Denise shuttled me into that spot. And then over the years, the previous medical director retired, and that left that spot open. So I then was given the opportunity to become the medical director, and I've been blessed to serve here during the last several years as the medical director.
Dr. Barbara Singer, welcome.
Thank you. It's such a delight and honor to be here. So I started in family practice and had my own practice here in Carroll for quite some time when one of the medical directors came to lunch and lured me over to this wonderful organization. And I have looked back never working with the people that I get to is an honor every day, and hospice and palliative medicine is a gentle and loving thing to be a small part of. And I am the medical director of the palliative program here, and can't believe I get to work with the team that we do here every day.
Yeah, thank you for that. Your position has been a little bit unique in the fact that not only helping with hospice, the medical director piece, you and Dr. Varney work hand in hand really as our palliative program has grown so much, and you've really taken such a huge role and stepped into that and become our medical director for palliative, and so we're really thankful for that. I wondered if when you started, could you ever imagine that we would have this palliative program, and here you are just helping us to run it and make it so successful?
And grow it to be all that this community needs. All the people who are really unwell and seeking treatment still for conditions that we can really help with their symptoms of shortness of breath and pain and some of their psychosocial challenges when their world is turned upside down by serious illness. And it's also a great way to reach out to people and help them on their journeys.
Yeah. I'm really excited for our April segment for TV. We're going to have our nurse practitioners and you, and we're going to go down to the clinic and just get another look at how the palliative clinic runs. So we're excited for that. But today I want to talk just a little bit about hospice care. And we do this every year. We kind of do a refresh about the second segment today. We're going to talk a little bit about myths and what people think and what hospice is and maybe what they don't understand. But I just wanted to touch base with you and just really see, why do you feel like hospice care is important? What makes hospice care important?
Well, we're all going to die. From the moment we're born, we're dying. Some of us are better at it than others. So the purpose and the role for us here is to be there at that stage of life when someone receives that terminal diagnosis or has that terminal transition in a chronic disease. Then the hospice role is to come in and to provide all the support and services necessary to make that end chapter of life's journey as good as it can possibly be. At that point, it's all about quality and not quantity. Mm-hmm. Now, as a teaching physician, I share with my students all the time that people have the right, everyone has the right to leave this world kicking and screaming if they choose. And to take that full code approach of pursuing every avenue to the very last bitter end and the last breath is everyone's right. Mm-hmm. But it's a privilege on our end to be able to participate during that chapter of life, to offer them a different way of looking at things, to offer them an avenue of saying, we realize that we can't fix this. And if we can't fix it, then we can at least make it better. Mm-hmm. So our job is really to help people accept and understand and to process, and also provide the care that is needed to chase away all the bad, all the symptom management, chase away all the pain and the suffering, the angst and the fear, to help them prepare and make that last chapter as high quality as it can possibly be.
Yeah, thank you for that. I always tell our staff and talk with our staff and say that, you know, we have one chance to do this the right way, and mm-hmm. it is so important for so many different reasons, healing and grieving, but why do you feel like hospice care is important?
Well, of course, all the very well articulated reasons that you said, but we are giving a lot of support to the families mm-hmm. so that it's less overwhelming and less defeating for the families. And people have this perception that if you sign up for hospice, you're going to have a shorter life expectancy, when all the studies show that if you take two people with equal conditions, the one who is signing into hospice is the one who will live longer. So I think we not only give quality of life for that time, we also give some extension of life compared to normal standard of care. So what a lovely thing to be able to just carry people gently until mm-hmm. it's their time. What an honor that is. So why do you think that is the case? So when a lot of times, I completely agree with you, and we see that when hospice steps in, so what do you think it is that hospice is adding that allows them that extra time? Well, we help them breathe better. Mm-hmm. We help their pain. We help anxiety. We help sleep. We help the family cope. We provide extra care as far as bathing and feeding and hygiene mm-hmm. aids, so that I think skin stays better. But all of those things amount to a more relaxed, contented, happy, and capable patient. I had a patient who was severely impacted by a cancer, and we got her comfortable, and she said, I went to a movie with my son for the first time in months and months because I could.
Wow. Mm-hmm.
And when you can still live your life, it seems like for whatever tangible and non-tangible reasons, people live longer.
Absolutely.
But more fully. And that's great.
Right. Yeah. My observation, I think the reason why that longevity is extended is because in medicine, we're disease-centric. Mm-hmm. When you are in the medical model of pursuing the avenue of curative care for everything, it's very disease-centric or process-centric. And in hospice and palliative care, it's patient-centric. Mm-hmm. So everything focuses on the whole of the person, not just with blinders on, how do I do the best job I can do with my part of this. We pull it all together and look at the big picture. So like Dr. Singer said, you make someone breathe better, mm-hmm. their quality of life is better. You take away that anxiety and that fear, they sleep better. We all know how important sleep is to our overall health. Then with all those things gone, they can eat better.
Right.
So there's just so many little factors that bring a tiny little piece into it. And whether it's just a matter of a couple of days or weeks or months we're talking about, the studies have shown, like Dr. Singer said, you start giving morphine for shortness of breath. They don't die sooner. They live longer.
Yeah.
And better.
I love that.
Mm-hmm.
Yeah.
Right.
Thank you. I love
Which
that.
is lovely. I just rounded a couple minutes ago here at Pickering House, and there was a family who said that their family member who had been hospitalized since early January was more interactive, alert, and present and comfortable than she has been in almost 2 months.
Mm-hmm.
And they're delighting in this time here at Pickering House that they're getting to visit and laugh with her. And yes, she will die probably fairly shortly, but she is where she has not been for almost 2 months,
Right.
present in herself and with her beloved people.
I think sometimes too, I don't think people realize that that can be the case. You know, when you're ill and you've been ill for a long time, you have multiple physicians, and all of those physicians do such important work. But it almost, I feel like too, gives them that peace that they know that those physicians can't make it better. But certainly they have that peace to kind of just, you know, like you said, understand that this is, they don't have to continue with all these different things. They don't have to reach out. They don't have to go back to the hospital. It's just all under one roof. Lots of times they worry about how their family's going to cope and any spiritual needs. So it's really that holistic approach that just brings it all together. And I think that's just what gives them that peace to you know, stay with us for a little longer. So, yeah. All right, so if you have any questions in regards to Fairhope Hospice, how to get a hold of us, it's really easy. You just need to make one phone call. That number is 740-654-7077. Give us one call. You will always reach a person who can answer questions for you and get you in the right direction. So thank you. You've been physicians for a long time. So let's talk, and a lot of that has been here with Fairhope and with hospice. So can you talk a little bit about something that, how has hospice changed for you? What have you seen? How is it different? Is there anything that really stands out?
Well, for me, there seems to be a greater awareness finally starting to happen, a greater utilization. When I first started here in Fairfield County, the very first meeting, this interdisciplinary team meeting that we do once a week, we have a census that we discuss, and we have all these patients under our care. That first meeting for me in 2003, our census was 35. Our census today is 170 something.
Plus, yes.
So, and that is not a reflection of growth in the county. The growth in the county over that time has been a single-digit % probably. So, more than 4 or 5 times 500% growth. So there's got to be something happening in the community with awareness. And that's something that I've been trying to really push. In my residency, I was fortunate enough to work with Tim Moore up at Grant Medical Center. He's a great doctor up there who taught me. And everywhere I went, I, for some reason, was just drawn to hospice. So I had never had a personal hospice experience until my own father died in 2012. So I don't know where that came from, but I was just drawn to it. So looking at that and that experience in my practice, I've always wanted to expand that knowledge in the community, to reach out to the residents, the medical students, and also to my colleagues, and just get the awareness out there that there's a way to help people at that end of life. And it's so easy to make happen. Like you said, just one phone call.
Right. Thank you. Do you have any thoughts about the things that you may have seen change in hospice just generally?
Right. What jumps to my mind is more in the palliative world, which is very different than the hospice world, or somewhat different. Again, the focus is the same, comfort, but I'm seeing in the evolution of cancer care, our patients are living a lot longer with disease states. With the evolution of cardiac care, our patients are living a lot longer with disease states. Challenging as well. And our role as easing that last bit is made complicated in some sense as, when do you stop fighting? When does a patient say, wow, I've been doing this for 5 years and I just don't have the steam anymore. I just want to relax and enjoy what I have for the rest of the time I have. With any condition, I see that being a bigger issue for people, is when do you make that call?
Right.
Now that we have these long chronic processes. And I think one thing that has, as much as the community being aware, is other physicians being more aware of hospice. Right. Because they're the ones who are having those initial conversations saying, we've done what we can, what we know in medicine now, and we think that you need to get more help with this part of your life, the end part of your life.
Absolutely. That's a great point, because we talk about marketing and you think, well, how do you market in hospice? But it is not necessarily the traditional marketing, it's education. Every day is education. Not only do you educate every day, our community, but our team does, our staff, myself, because and like you said, the more the physicians understand that, there's a comfort level for them to give us a call and to reach out. And you know, like you said, our census has grown so much, and this past year it's grown just, you know, twice what it ever has. And people may think, well, why is that a good thing? And your first statement when we started is that everybody is going to die, and we want that opportunity to just make it just a gentle journey. And I think that's what's happening, as more people understand really what that can look like. So I'm, you know, very thankful for you guys and for all that our team does. Okay, well, let's give that information one more time. The phone number to call at Fairhope is 740-654-7077. Just give us a call. You can visit us at our website, fairhopehospice.org, and follow us on Facebook. Any information that you need will be located there, or give us a call and we're glad to get you in the right direction. So we're going to come back here in just a few minutes for segment 2. We're going to talk a little bit more about Fairhope Hospice with our 2 guests today. It is so important for families to feel comfortable and safe when they call, because oftentimes that first phone call, even picking up the phone physically and just dialing that number, is very hard. You're asking for something that is a very difficult and private decision, and so we want everyone to feel comfortable and safe that you pick up that phone, you make that phone call, and let us just guide you and lead you where you want. And then you can make an informed decision about what's best for you and your family.
The Frankie Smith Funeral Home and Crematory in Lancaster and the Johnson Smith Funeral Home in Baltimore have a long and wonderful history of serving our community. Feel free to give us a call at 740-653-0652. Stop in and see us at either of our 2 locations, 405 North Columbus Street in Lancaster and 207 South Main Street in Baltimore. Respect for tradition, regard for change.
At Fairfield Federal, we believe true prosperity is shared. For 130 years, Fairfield Federal has invested in the community that built us. From supporting businesses that employ our neighbors, empowering the initiatives that strengthen our community, and serving generations of families, Fairfield Federal is proud to share this milestone of progress with our hometown. Fairfield Federal is your place for checking, savings, and home loans. Member FDIC, Equal Housing Lender, NMLS number 402612.
At Fairfield DD, our mission is to create a vibrant community where people can lead lives of greater independence and make meaningful contributions. Technology can help each of us accomplish things we didn't think were possible. That's why we created the Enabling Technology Lending Library, a free resource where you can try smart devices that promote independence and connection. Explore it all from home with our virtual tour. See what's possible and then borrow what you need. Visit fairfielddd.com/lending library and start your journey today.
Welcome back to Fairhope Hospice Today. Thanks for staying tuned here at our second segment. And today we have with us Dr. Brian Varney, Dr. Barbara Singer. Thank you guys for joining us. And it's always a privilege to have you here to kind of talk about your history and Fairhope and how and what you've really meant to our organization, how you've seen us grow and change, and you've been such an integral part of that. So we're very thankful for that. I wanted to take a second. We had such a good conversation the first segment, but I wanted to just take a little second and talk about some of the differences. You know, Fairhope is a nonprofit agency, and we're really proud of that. We've been in the community for 42 years now, so that's really something to be proud of. But in your experiences and just in the community and in different areas that you've worked, what types of differences do you see between nonprofit and for-profit? And just any thoughts on that?
Well, you know, Fairhope, I didn't know that Fairhope was the hometown not-for-profit hospice when I walked through that door so many years ago. I've been with this organization since 2003, and it's just a daily blessing to be part of this group. The big difference that I see in a not-for-profit hospice is just the caring and contribution to the community. When you talk about a for-profit organization, they have investors, and investors expect returns. So the monies that are made, the profit margin, is distributed to the people who have a vested interest. In a not-for-profit organization like Fairhope, that money doesn't get distributed to some individual in the community.
Right.
It gets put right back into the organization in the ways of bringing in more staff. It gets used in adding programs, our bereavement program and things like that. The funding comes from whatever profits, so-called profits, are made. They're not distributed and spent. They're funneled right back into the organization to help us give better care and have more people involved where they need to be involved.
Right.
Yeah, the key word is more. By not spreading it to shareholders or investors, we're investing in our patients more. We give more, we can do more, we have more flexibility, we have so much more by being not-for-profit.
I think that people over profit is exactly where it is. And I know my predecessor, when someone would come to her and say, you know, we really need this, and her first question was always, is this what's is it going to be best for the patient? And if the answer is yes, then we provide that. So, you know, we see lots and lots of things that our patients need. Oftentimes at this point, they're not able to maybe afford a particular item or something that they really need to make them comfortable. Those are the things that we are very fortunate to be able to provide to our patients and families. And I always make sure that I ask that question: is that's what's going to be best for the patient and for the family? And those things could be, you know, anything, special equipment needs, just all kinds of things that you can think of. Maybe we increase their care a little bit because there's an elderly spouse taking care of them. So we're really privileged that we're able to do those things. The donations that we receive every day, those go back and help our families that are in need. You know, nobody is ever turned away for their inability to pay, and that makes us, you know, feel really very proud of what we do every day. So I appreciate.
That makes us different.
It makes us different.
More.
Yeah, that's right.
Makes us more.
So we touched a little bit. You guys are both coming to me today for TV from what we call our team meeting. And that's where we really review all the things that we need to review about our patients. And one of the things that I love about that meeting and have forever, and dear Dr. Gordon Snyder was always a great teacher, and you two have carried on that wonderfully. But just to kind of teach our staff, you're always teaching. I mean, what does that look like when you're in this meeting and there's 50 people in the room and you think to yourself, okay, this is important enough that I need to share it? Like, thank you for that, but how do you feel about that? That you enjoy that and you feel it's important enough?
It's a delight, and we have this great team of bright, young nurses, not all young, but you know, bright people learning so much, and the more that they know, the quicker they are to pick up on things that might need attention more quickly, the more that they know. And medicine is a a foreign language on many levels. We were talking about how many diseases are no longer, you mentioned, they are no longer going by the name of the person who found that disease initially, but now by other names that are more characteristic of the disease. So there's even this whole new body of knowledge that our nurses and us, we all have to learn and to be capable and to be the best practitioners we all are learning to be. And I'm proud of the practitioners we have here, you know, at every level.
I do. I love the interaction when a nurse may say, hey, I have this situation, I'm just not quite sure how to handle it. And you open it up to the team and you see not only the other nurses helping, but then you guys. And you know, you two have lots of ideas. You may share things one way that you've done, and then you have another way that's worked. And so I just love the fact that our team feel comfortable enough for you and that you are there for them. There's never a question that they don't feel comfortable asking you, and I just think that's really really special.
Well, Kristen, you'd said we call it team. It's our team meeting, but the T is only the one part of the name. It's the interdisciplinary team. And in medicine, IDT, or interdisciplinary team approach, is really the only way to practice medicine. You can't practice in a bubble. You can't practice in a vacuum. You have to be able to understand and fully incorporate every aspect of the care. And in all walks of life in the medical realm, it's used, but it's not always visible. And I tell our students, when you come here to rotate with us, it's one of the few places where you're going to experience the interdisciplinary approach fully utilized. At that team meeting, we have social work, we have our chaplain, we have the nursing staff, we have the administrative staff. We have everyone comes together, and everyone's contribution is valid and welcomed and cherished, and it's all used together to come up with the best possible plan of care and the best outcome for our patients.
I love that. I love that. Thank you. I'm going to give you our number. The number here at Fairhope is 740-654-7077. Please feel free to give us a call if you have any questions, anything that you just need to inquire about. One call. There will be someone that answers your call and gets you in the right direction. So, all right, we have a few minutes left here. So I want to talk a little bit about myths. We do this every year, and you say, what are the myths? You know, but honestly, there are times when our families really struggle to make the decision to come to hospice because there's the myth there, maybe something they heard that they don't understand. So I have a couple I want to kind of talk about. So one thing that is a myth that comes up sometimes is hospice is only for cancer patients.
Well,
we know
clearly that is not the case, that we have cardiac patients, pulmonary, people with lung problems, pulmonary patients. We have patients who have had falls, or there's just this wide spectrum of anything that brings you close to the end of life where you would need supports. And by close to the end of life, that's 6 months in theory, but I think we've had some people on for many years. And in part, they're on for many years because they're getting such good supportive care, and that's been a big deal. So, not just for cancer patients, people with neurocognitive things, Lou Gehrig's disease or ALS, dementias that are advanced, Parkinson's disease that is advanced. All the basket of things that we treat is so wide. And that's part of why, as we were talking about education, why the teaching that we all do is so important, is that we're serving so many different and sometimes extreme conditions.
Right. And you can see the percentages of those numbers changed, I think, probably when you guys started, and then even when I started many, many years ago too. You could see the bulk of the referrals and the care that we gave were for cancer patients. That's really changed now. So I think that's great. You kind of led me into my next myth, and that is patients can receive hospice care for a limited amount of time.
That's a big myth. And the thing is, everybody thinks you have to be actively dying to seek hospice care. And like we started this out, we're all dying. We're just at different stages in that process. Now, like Dr. Singer said, the theoretically part of it is 6 months. Because for us to refer a patient to hospice care, for a physician in the community to call hospice and say, I'd like my patient admitted to your service, there has to be the expectation of a 6 months prognosis. And that's sort of a rough estimate. There are some very well researched criteria that we use with each disease process, which helps us look at a patient to say, you meet this, and this criteria, you're likely to leave this world within 6 months. And with that information, that referral is made. But not everybody follows that. I say all the time, patients don't read the textbook, so they don't know how their life is supposed to go sometimes. So if you live longer than 6 months, then there's a process called recertification where we take that same patient situation and we reevaluate. And as long as they continue to meet the admission criteria, it doesn't matter if they've been on hospice for 6 months or 6 years, as long as the criteria are honestly and conscientiously applied and met, they still are appropriate to receive hospice care.
People, that is a perfect explanation of what people sometimes don't understand. And our message oftentimes is, please come to us before you're in that crisis situation or at the hospital, and allow us to kind of work the things that we do with all of our staff before you get to that point where it feels so emergent. So yeah, thank you for that. Okay, we have time for one last myth, and this one is that hospice is a place.
Oh, it is a place, anywhere.
Good, yes.
Anywhere, in your home, at times at our facility, when families need a break or a patient needs extra care for symptoms, hospice is wherever you need it to be. And we have some patients at the hospital who are in the comfort care unit who are on hospice. We have so many different ways that we get to serve families the way that families want to be served and need to be served. And we have patients at the facilities, at the skilled nursing facilities and group homes. There's no place except for it's every place.
It is every place. I love that.
I just think of it with like the spiritual aspect of what we bring to the picture. And you think about, when you hear the term the church isn't the building.
Oh, right.
The church is all of the people. And not only when they're gathered in the building, but what they do in the community and their outreach. And I kind of think of that as almost a synonym to what we are here. Hospice is, like Dr. Singer said, everywhere.
Right.
We can touch your life, and we can provide aspects of care in whatever setting in which you live. So you don't have to be in our building or at our place. We can come to your place.
Yeah. Hospice is wherever you call home, wherever you need to be at that time is where we'll meet you. So
Absolutely.
Okay, we could probably keep talking for another hour or so, but our time is up here. Thank you so much for being with us. Thank you. I know you both had a big meeting this morning. You both have your phones going. You're on call, so I appreciate your time very much.
Glad to be here.
And thank you all for joining us on Fairhope Hospice today. I'm Kristen Glazier. We'll see you next time.
IVP Media presents Fairhope Hospice Today, brought to you by Fairhope Hospice and Palliative Care, Fairfield Federal Savings and Loan, the Fairfield County Board of Developmental Disabilities, and the Frankie Smith Funeral Home.